Do you know you can start your residency training in the UK without necessarily having a UK work experience? Do you also know that you can start your GP training in the UK to become a GP without coming to the UK to do the entrance exams? In this video, I'm going to show you how to go about that. Hello, welcome to my channel. I'm Dr. Pepple. I do YouTube videos for international students and international medical graduates who are transitioning to study, practice, or work in the UK. If you're new to my channel, please hit on that subscribe button on the lower right hand corner and tap on the bell notification if you like the content of this video and of this channel, so you always be the first to know when there's a new video. Now let's get straight into business. Guys, as at today, the day of recording of this video, which is the 5th day of November 2020, the application window for specialty training in the UK for doctors wishing to go into any specialty of your choice has just opened. What does that mean? It means from now onwards, you can apply to go into any specialty training in the UK. Medical, surgical, GP, run-through programs, whichever one of your choice. But you know what? You need to know the process and you need to meet the eligibility criteria. In this video, I'm going to talk specifically about how to get into GP training in the UK. There are basically 3 routes of training in the UK for anyone who's going into postgraduate medical education. So you can go through the specialty or the core training route, which is basically into medical and surgical specialties. So for instance, let's say you want to be a cardiologist. So you can go into internal medical training where you do the core training year 1, year 2, and you reapply to go into specialty training ST3 up until you graduate ST7 or thereabout. The same thing applies for the surgical specialties where you can apply to go into core surgical training. We do 1-2 years. And thereafter, you can apply to go into specialty surgical training, whichever specialty, surgical specialty of your choice. And you do that up from ST3 to ST7-8. The second route is the GP training route. Basically, this is sort of a straightforward process where you apply to go into GP training, which is for 3 years. So you do half of your training in the hospital and half in the GP surgery, meaning you're going to spend 18 months of your training in the GP setting and 18 months of your training in the hospital. That's the main one I'm going to talk about now. And the last route is the run-through program. So run-through program basically is the training pathway where you get into a training post and you continue till the end without having to reapply at some stage to go into specialty training. Run-through program route is basically for obstetrics and gynecology, radiology, psychiatry, and the rest of them. I've done videos in the past on specialty training application and how to go into that in the UK. If you want to check, I'll put the link below so you can see that and get a better understanding of how that works. Now to GP training. So the main reason for doing this is to give you an enlightenment that you can actually apply for GP training anywhere in the world. You don't necessarily have to come to the UK to do the exams. You also don't necessarily have to have a prior knowledge of how the NHS works in terms of having a UK work experience before you can apply for GP training. Now, because of COVID and stuff, everything is straightforward. And that's what this video is about. The number one thing you need to do to apply for GP training in the UK is that you need to have become a doctor, meaning you need to have a primary medical qualification that is approved and accepted by the General Medical Council, the GMC of the UK. If you go to the GMC website, you will see a list of accredited universities and medical institutions all over the world that their documents or their primary medical qualification is acceptable by the GMC. And if that applies to you, then you are on your way to practicing in the UK. And may I say that the GP training in the UK is the equivalent of family medicine, some other places in the world, in Nigeria, the rest of Africa, and also family practice in America. The most important step towards becoming a GP in the UK is having the GMC registration. And how do you get that? For international medical graduates, for anyone who is a non-EU, non-British national who has schooled outside of the United Kingdom, you will need to sit the PLAB exams as what gives you the license to practice in the UK. When you sit the PLAB exams, which is PLAB 1 and PLAB 2, before you sit PLAB 1 and PLAB 2, you must have done the English language test exams. So it's either you do the IELTS or you do the OET, which is the occupational English test. I think that is a bit more tailored towards the medical profession. So that's why a lot of people opt for that option right now. So when you pass PLAB 1, PLAB 2, you do EPIC verification, you get your GMC registration. I've done videos in the past about that as well. You can check, link below. So when you've gotten your license from the GMC, most likely you will be getting a full registration to practice in the UK. Then you can apply for GP training in the UK. The first process towards applying to become a GP in the UK is to have an Oriel account. If you go to Google search, type in Oriel, this is how it appears. You go through the whole process, fill in your documents, fill in all the details that are necessary, and that's it. You've got an Oriel account. Oriel account is what you can use to apply for any job at all in the UK, any training position in the UK. In the past, after applying for GP training, you need to sit the SJT exams, which is the situational judgment test. You need to sit the written clinical exams as well. When you pass that, you will be shortlisted to go for interview, and after the interview you'll be made an offer, and after the offer then you can officially start the training. But with COVID and stuff, things have changed, so these exams have been collapsed into just one exam, so there's no interview anymore. That has made it a lot easier for people to go into training, and also the number of people needed to fill in the training positions for general practice for this year has also increased. So the exams, like I said, is the multi-specialty recruitment assessment exam. Basically, it's called MSRA because you can also use this same exam as a recruitment process or the selection exam for other specialties. The MSRA exam is a computer-based exams, most times taken in the person view test centers. Person view test centers are all over the world. So if you are abroad, if you're not in the UK, all you need to do is to go to the GNPRO, which is the General Practice National Recruitment Office website, and you will see the person view test center that is close to you. Remember, the MSRA is a computer-based exam, so it can be taken anywhere in the world. So even if you're in Nigeria, in Africa, in the Caribbean, wherever it is you are, you don't necessarily have to come to the UK to take the exams. And if you get the required score, you will be accepted into the GP training program in the UK. So the structure of the exam is in two parts, taken on the same day. There is the professional dilemma questions, which is for 95 minutes. And there is the clinical solving skills questions, which is for 75 minutes. These two components are taken at the same time on the same day. What resources do you need to practice for these exams, and how long do you actually need to practice for this exam? So the application window, like I said, has just opened now. The exam itself is taken in January. So you can imagine you've got just December and January to prepare for the exam, which is quite enough time to prepare, to be honest. I've done videos on how to prepare for exams, which you can check also on my channel to see if that's going to benefit you in any way. So the revision materials and the study materials I think you need will be Oxford Handbook of Clinical Medicine, Oxford Handbook of Clinical Specialties, Oxford Handbook of General Practice, and the Oxford Handbook of Foundation Year Program. You don't necessarily have to read these 4 books back to back, but they will be very good reference guide for you as you're preparing to go into GP training and also to take the MSRA exam. But I think the most important resource you need will be question banks. Question banks, you can use there's a Q bank, you can use the eMedical, you can use PASS test, you can use PASS medicine, A lot of people like to combine question banks so you have a variety of topics you're reading from. Personally, when I did my exams, I used about 2 question banks and I practiced for about 4 to 5 weeks or thereabout. Went for the exam, sat the exam, and was successful. So you can actually use, I would advise you to use more than one question bank. It might be expensive, but this is something you really want and it's worth sacrificing for, just to make sure that you don't do it twice. Okay, now this window that has been opened now is actually for entrance in August 2021. So the application window for August 2021, which is your start date for the new job, starts in November. The exam is taken in January. When you pass that, you'll probably get your offer letter and everything around March, April, getting you ready to start the actual job in August. After the March offer, spaces that are left are re-advertised. So that's the re-advert, and people can apply again, but that's going to be very limited spaces. Then those ones, when they also go through the whole process and eventually get an offer, they're going to start the same time as you who have just passed in January, March. So all of you will be starting the training at the same time in August of next year, if that makes sense. So this is just a quick summary of how you, as an international medical graduate who hasn't got any UK work experience, who wants to go into specialty training, who wants to go into GP training in the UK, can start getting your acts together, get all your documents together, apply, and possibly you get an offer and you can start planning to come over to the UK to practice as a GP. Bear in mind, the GP program is very fast paced. It's only for 3 years and you're done. Before I end this video, I would like to say that the GP training in the UK is a bit different from some other countries, especially if you're coming from Nigeria or Africa. For instance, in Nigeria, if you are doing family medicine training, which is the equivalent of general practice, you will compulsorily rotate around certain specialties. So you will probably go through obstetrics and gynecology. You will spend some time in surgery, you spend some time in pediatrics, and spend some time in medicine. So you're going through the 4 block rotations in or during your training. In the UK, it's quite a bit different. You've got 18 months to spend in hospital rotation, and you've got 18 months to spend in the GP surgery. GP surgery basically means the clinic. The 18 months you've got to spend in the hospital, you have the prerogative to choose what rotations you want to choose. And the rotations you are choosing are based on your preference, based on your likes, based on your knowledge, or based on your knowledge gap, as it were. So you can, if you haven't got so much knowledge about internal medicine, you can decide to choose to do maybe 4 months or 6 months or 3 months of internal medicine. Choose to do 3 or 6 months of pediatrics, ENT, orthopedics, lab medicine, whatever it is you decide. So you will be given options of block rotations. So you pick and choose whichever one that fits you. So there is no, so to say, compulsory rotation during your GP training. You do the ones that are tailored to your specific needs and the ones you think will make you a better GP. If you have problem with choosing rotations to do during your GP training, link down below. I've done video on that, and I think that's going to be a very good guide for you. All right. I hope this video has answered some questions you've got in your mind. If you're not very satisfied, or if there are things you need more clarifications, I'm always happy to do that. You can contact me on Instagram. That's where I share my daily experiences in life. So Dr. Pepple is my Instagram handle. I have started recently to become active on Twitter, so you can also get me on Twitter. That's my handle there. And yeah, send me a message, private chat me. I'm always happy to respond to you. Comment below, drop a like if you want, subscribe to this channel, turn on the bell notification, and that's how you encourage me to keep putting new content on here. Thank you. Bye.